Understanding Sexual and Urological Dysfunction, Restoring Pelvic Health with Dr. Rena Malik. Hello, my lovelies, and welcome to this special episode where we'll delve into the intricate realm of sexual and urological dysfunction, as well as the ways to restore and enhance pelvic floor function and ensure proper neural and vascular blood supply to the genital organs. Today, I will be your guide on this journey of understanding these vital aspects of health. Dr. Rena Malik, Maryland, is a board-certified urologist and pelvic surgeon, renowned for her expertise in pelvic medicine and her contributions to public health education. Her insights have shed light on issues that can affect both men and women, offering valuable solutions to manage these challenges. Let's embark on a quest for knowledge and uncover the major causes and treatments for these concerns. The causes of sexual and urological dysfunction can be diverse, encompassing physical, psychological, and lifestyle factors. These range from hormonal imbalances to chronic diseases like diabetes and hypertension, pelvic traumas, or past surgeries. Stress, anxiety, and depression can also impact the normal functioning of the urogenital system. Treatments for sexual and urological dysfunction vary depending on specific causes. They may include hormone therapies, lifestyle modifications, psychological therapy, and even surgical interventions in severe cases. One key approach that Dr. Rena Malik advocates for is physical therapy to restore pelvic floor function. Physical therapy focuses on specific exercises to strengthen the pelvic muscles and improve blood circulation and neural supply to the area. This can contribute to improved muscle control, pelvic pain, and sexual function. Additionally, adopting a healthy lifestyle with a balanced diet, regular exercise, and stress management can positively impact pelvic health and sexual function. In conclusion, exploring Dr. Rena Malik's writings and understanding the major causes and treatments for sexual and urological dysfunction can be essential to our well-being. Physical therapy for pelvic floor restoration and adopting a healthy lifestyle can play a significant role in enhancing our quality of life and sexual function. We've reached the end of this informative episode. I encourage you to seek more information from reliable medical sources and, if you're facing such issues, consult a specialist for personalized evaluation and guidance. Thank you for joining us and choosing to delve into this crucial topic. Until next time, take care of yourselves and your health.